In Virginia, the Medicaid program goes by many names and covers many services. In fact, it has so many names that sometimes people don't realize they're on Medicaid. So we wanted to go through some of the names today just so you're better aware. There's the Cardinal Care, Medicaid Expansion, Medicaid Works, Age Blind and Disabled or ABD Medicaid, the Medicare Savings Program or MSP, PACE, Famous or Famous Plus. And then there's also waiver programs like Building Independence, Family and Individual Support, Community Living, the CCC Plus program.
With these programs, Medicaid weaves a vital safety net of health care for low-income and medically complex children, adults, and seniors. It bolsters local health systems, and it improves access for all Virginians.
What is Medicaid? Medicaid is healthcare coverage for nearly 30% of all children in Virginia. Medicaid is vital care for children with complex health needs. Medicaid is funding for school nurses who administer life-saving EpiPens and nebulizers to children in schools. Medicaid is prenatal and postpartum care for pregnant people so that they can have healthy deliveries. Medicaid is supplemental coverage for 1 in 10 children of active duty service members.
Medicaid is health care for adults ages 19 through 64 who make around $21,500 per year or less. Medicaid is the lifeblood of rural health systems and helps rural hospitals keep their doors open. Medicaid is treatment for opioid use disorder. These medications save lives, but without health coverage, they just aren't affordable.
Medicaid is dental care. Medicaid is functional behavioral medical support that's tailored to the needs of individuals with developmental disabilities so that they can maintain independence and work. Medicaid is the primary source of funding for mental health care nationwide.
Medicaid is health care for low-income people who are 65 or older, blind, or disabled under Social Security program rules. Medicaid is also supplemental insurance for low-income people who are on the Medicare program. Medicaid is dementia and Alzheimer's care. Medicaid pays for 60% of long-term services here in the U.S., and that's whether someone's in a nursing home or in a home care setting. In fact, 1/3 of total Medicaid program costs come from long-term service and support costs.
Medicaid is there for Americans, from birth through end-of-life care.
A safety net only works if you don't cut holes in it. We need to protect Medicaid and make sure that it keeps working for every American who needs it when we need it.